Is it time to consider couples therapy? Let's talk about it. My name is Ann. I'm a licensed marriage and family therapist and LMFT approved supervisor. I am licensed in Illinois and Wisconsin. I do educational only videos, which means it doesn't reflect my employers, those that work with me. It doesn't affect the LMFT. I am not somebody that represents all LMFTs. I am one person that works under my license and trying to give you educational videos, especially about relationships as a relational expert. I'm an ADHD expert and a relational expert. Most people, you will find they come to couples therapy, quote unquote, people say when it's too late. Now, I'm somebody who are being a relational expert. I've caught people way at the end before divorce and we've been able to improve their relationship. Now, what that means is I don't have an investment if people stay together or not. I have an investment of improving their communication and their relationship. And if at the end they decide, it means I am not biased to keep people together or apart. It means that I am neutral and it is what they want to do. And if they don't know, it's our job to explore with them. Yet when I say most people come too late, it means when it's resentment, one person is too far gone, there are so many secrets, individuals are just not aligning, or it's the end of their relationship and they kind of were just coming for a checkmark box. And sometimes they're even coming for mediation before court date. Goals will be totally different for each couple. But let's talk a little bit about 5 signs that science will tell us that potentially it might be time for couples therapy to be considered. We're not telling you what to do. We don't do that. We don't give advice. The first one is emotional distance. It's a gap in intimacy. Sometimes it can be physical and sexual. Sometimes it is emotional. When it comes to either of those things, it's being emotionally unavailable, which will lead to the second one, which is right here, avoiding the hard conversations or difficult conversations. Very common. And whether that means you're sweeping it under the rug, you are stonewalling, you're not talking about it, you're just avoiding it altogether. My favorite line. See, this is why I didn't bring it up because I knew you're going to react this way. The third one is it's the same argument, whether in topic or in the vibe. It is the same argument over and over and over and over and over and over and over again. It's a pattern. You've tried everything. You've even used ChatGPT maybe to help you out. And it's come up on E. Not me necessarily people need to use ChatGPT, but I recognize the reality of 2026. The fourth one is tough. Feeling like roommates, just doing your routine every single day. And there is the lack of that spark. You're wondering, and it's not necessarily sexual or physical intimacy, it's just enjoying or having fun, dopamine boosting, right? Adrenaline, which is a huge part in science, Gottman, that in Gottman models, they will tell you that adrenaline versus cortisol, those are really important things to consider when you're in a relationship. So whether your cortisol is just really, really high when you're around the individual, or whether your dopamine is low, or your adrenaline is low. The final one we see is that feeling of walking on eggshells. This means you're just very extremely cautious of anything you're saying and anything you're doing. You are trying your best not to upset or anger the other person. Now, I will tell you that working with ADHD as both an ADHD and relational expert, this is one that comes up a lot because whether it's overstimulation, the individual, whether they have difficulty with emotion regulation or other executive functioning skills, there is often unpredictable or highly sensitive behavior. Regardless of the reasons, we want to make sure that people are safe and that they're able to communicate and talk. So these are just some warning signs. And if you feel like there's 1 or 5 of them that are in place, maybe it's time to consider it. You can call your insurance company and see if they cover 90847, which is relationships. You can also call around to see if there are individuals that take sliding fee scales. Some people do pro bono work. There are some training programs that will actually provide low cost to free care, but please know it's normally co-therapy or it's an in-training person, or it is somebody that is still in a program that's learning. Yet it still is access, and even if they're in training or they are students, please know that they have a supervisor that is overseeing. They either have 5 years experience, a PhD, an MDDO, or it can even be an AMFT approved supervisor. So they have somebody that's in their corner. Whatever you're needing, there's where it is. And there are a lot of us that are licensed marriage and family therapists that take insurance and self-pay. So make sure to look online, ask any questions below. And again, happy to be here for educational only content. And I hope you have a great day. Evolve and heal on, my friends.